You're listening to Nursing Survival. Today's episode is about glomerulonephritis, and we're going to review the kidneys. Hey, future nurses, welcome to Nursing Survival. I'm Nurse Camille. If this is your first time listening, then thanks for coming. This podcast reviews all the important information about medical conditions, specifically for nurses. This will help you in nursing school, for the NCLEX, as well out in the real world. You can find the study guide that goes along with this episode on nursingsurvival.com. I've created several guides that can help you really understand the information. New episodes come out weekly, so add me to your favorites. You can also follow me on Twitter, Facebook, or Instagram. Let's start studying. Glomerulonephritis, or nephritis, is inflammation of the glomeruli, which are located in the kidneys. Glomeruli are teeny vessels in the kidneys that filter fluids, electrolytes, and waste. The inflammation causes both structural and functional changes to the tissue. Glomerulonephritis can be either acute or chronic. We're going to review the basics of the kidneys to help you better understand how they are supposed to work. You have two kidneys that are about the size of an adult fist. The kidneys consist of an outer cortex and an inner medulla. They receive blood through the renal arteries, and the blood flows into smaller and smaller vessels into the arterioles. The blood goes from the arterioles into the glomeruli. They are basically the renal capillaries. The blood is filtered by the nephrons, which consists of a glomerulus surrounded by the Bowman's capsule. Fluid exits the Bowman's capsule into the proximal convoluted tubule, then into the loop of Henle, and then into the distal convoluted tubule. Function of the kidneys includes removing waste and excess fluid from the body. They are instrumental in fluid and electrolyte balance. In normal adults, the kidneys filter about 47 gallons of fluid a day. Only about 1.5% to 2% of the fluid becomes urine. Metabolic waste, such as urea, acids, toxins, and drugs, are all filtered out because of the kidneys. They also allow other products to re-enter the bloodstream. Glucose, sodium, chloride, potassium, and acids are all excreted or reabsorbed in the kidneys. Another function of the kidneys is blood pressure regulation. Sodium and fluid both affect blood pressure, and the kidneys directly influence both. They also produce the enzyme renin, which when released into the bloodstream causes the blood pressure to rise. Renin works on angiotensin II and aldosterone to increase the absorption of sodium, increase fluid retention, and raise the blood pressure. When renin levels lower, both angiotensin II and aldosterone levels lower, and the blood pressure decreases. The kidneys control the production of red blood cells. The kidneys produce the hormone erythropoietin, which stimulates red blood cell production in the bone marrow. The kidneys also play a role in the growth and maintenance of healthy bones. They regulate calcium and phosphorus levels. Both calcium and phosphorus are critical for healthy bones. They convert vitamin D, or calcitriol, into an active form the body can actually use. Vitamin D stimulates the absorption of calcium and phosphorus from the small intestines. It is important to remember that the kidneys are involved in so much more than just urine production. When they are damaged or impaired, multiple body systems are influenced. Now back to glomerulonephritis. Next, we're going to review the causes of it. In acute glomerulonephritis, it can be caused by an infection such as strep throat or impetigo. Other illnesses linked to glomerulonephritis include lupus, Wegener's granulomatosis, and diabetes. Heavy use of non-steroid anti-inflammatory drugs, or NSAIDs, and high blood pressure can also cause it. With chronic glomerulonephritis, the exact cause is often unknown. There may be a genetic factor. Autoimmune diseases have also been linked to it, as well as cancer. Environmental exposures to hydrocarbon solvents and chemicals may also contribute. Any condition or factor that can impair the kidneys may trigger glomerulonephritis. In order to diagnose glomerulonephritis, the medical provider will need to conduct multiple tests. A urinalysis may be conducted to detect various compounds in the urine. The test may show blood in the urine or protein. A protein level greater than 8 is considered abnormal. A 24-hour urine collection is another test that can check kidney function. It can be started at any time, but is normally started in the morning, and it can be done outpatient. The patient is usually asked to discard their first urination after waking. The urine is kept in a large container and needs to be kept cold, either in the refrigerator or over ice. A lab value of over 80 milligrams of protein in a 24-hour urine collection is considered abnormal. A urine-specific gravity test compares the density of urine to the density of water. It can help determine how well the kidneys are filtering out substances in the body. A high urine-specific gravity indicates that the kidneys are not filtering compounds back into the body. A level greater than 1.020 is considered abnormal. Creatinine is a waste product that naturally occurs in the body by the breakdown of muscle tissue. The kidneys normally filter it from the blood. A creatinine clearance test helps determine the overall glomeruli filtration rate, which reflects how well the kidneys are filtering the blood. A level greater than 139 in men and greater than 107 in women is considered abnormal. Blood tests will also be conducted. The patient may be anemic due to impaired red blood cell production due to the impaired kidneys. A hemoglobin less than 13.5 in men and 12 in women is considered low. Albumin is a protein that may be low in the blood when the kidneys are damaged. The kidneys typically filter albumin back into the blood system. When the kidneys are damaged, greater levels of albumin end up in the urine. A normal range of albumin is 3.4 to 5.4. Blood urea nitrogen, or BUN, is a substance produced by the liver to help break down proteins. The kidneys normally remove BUN from the blood. A level 7 to 20 is considered normal, and it will be elevated if the kidneys are impaired. A blood creatinine level will also be elevated with kidney impairment. High creatinine is a level greater than 1.2. The patient may also have hyponatremia, which is low sodium. This could be caused from fluid overload. A sodium level less than 135 is considered low. High potassium or hyperkalemia may occur due to the kidney's impaired filtration. A level greater than 5 is considered abnormal. A kidney biopsy is a procedure in which a small portion of the kidney is removed for laboratory analysis. The medical provider may order a biopsy to further investigate the kidney's function. During the procedure, the patient will not be sedated. The patient usually is positioned on their stomach or prone. The kidneys are easily accessible from the back. The patient is asked to lie on their back for 6 to 12 hours after the procedure and to avoid strenuous activity or heavy lifting for up to 2 weeks. The patient may experience blood in their urine for the next few days. Risks from a renal biopsy include infection at insertion site, bleeding, and blood clots. A renal ultrasound uses sound waves to create images of the kidneys. It can help detect masses, tumors, kidney stones, or other obstructions in the kidneys. The patient may be positioned on their back, side, or stomach. This procedure is non-invasive. Computerized tomography or CT scans use computerized images and X-rays to create images of the kidneys. A chest X-ray may be ordered to help view changes in the body. It may show an increased cardiac size or a pleural effusion. Signs and symptoms of glomerulonephritis include typical symptoms of kidney failure. The patient may experience preorbital edema. They may also have edema throughout the body, including their extremities. Ascites is fluid overload in the abdomen. Oliguria is low urine output, which is less than 30 milliliters an hour. Hematuria is blood in the urine. Nocturia is frequent nighttime urination. Proteinuria is protein in the urine. The urine will look bubbly, frothy, or foamy. The patient may experience coughing or shortness of breath. You may hear crackles in the lungs, which indicate fluid. The patient may complain of pain in the back or abdomen. They may also have headaches. The patient may have nosebleeds, or they may notice impaired clotting at cut sites. The patient may also be anemic. Signs of anemia include weakness, tiredness, and dizziness. Remember that the patient may have impaired red blood cell production, as well as loss of red blood cells in the urine. Fluid overload can also dilute blood cells. A fever is another sign. Jugular vein distension occurs when increased pressure of the superior vena cava causes the jugular veins to bulge. It can occur on one or both sides of the neck. To assess the patient, they will need to be positioned lying on their back. They elevate their head at a 45-degree angle and turn slightly to one side. The jugular vein will bulge or pulsate when the patient has increased central venous pressure. Greater than 2.5 centimeters is considered abnormal. JVD can be caused by many factors, including renal issues. Central venous pressure indicates how much blood is flowing back into the heart and how well the heart is moving the blood throughout the body. Complications of glomerulonephritis include kidney failure. Symptoms of kidney failure include fatigue, loss of appetite, nausea, vomiting, insomnia, dry, itchy skin, muscle cramps, as well as serious electrolyte imbalances. Hyperkalemia is potassium level greater than 5. Hyperkalemia can lead to cardiac arrest or death. Remember that potassium plays a vital role in both smooth and skeletal muscles. This includes the cardiac muscles. Hyperkalemia can lead to dysrhythmias. Another electrolyte balance is either hyper or hyponatremia, which is the body's sodium level. The patient may become fluid overloaded, leading to hyponatremia. It is a level less than 135. Symptoms of hyponatremia include altered mental status, fatigue, restlessness or irritability, muscle weakness, spasms, or cramps. Hypernatremia is a sodium level greater than 145. The patient may have higher sodium levels due to impaired renal filtration. Symptoms of hypernatremia include excessive thirst, extreme fatigue, confusion, and muscle twitching or spasms. Another complication of glomerulonephritis is nephrotic syndrome. It is characterized by protein in the urine, a low blood albumin level, high blood lipids, and edema throughout the body. It can occur due to inflammation of the glomerulus, which allows molecules such as protein and albumin to pass into the urine. Albumin helps with onconic pressure, which keeps the fluids in the body where they're supposed to be. Low albumin leads to edema. The liver tries to compensate for the low albumin levels by synthesizing proteins, which results in hyperlipidemia. With nephrotic syndrome, the patient may notice frothy or foamy urine, edema throughout the body or generalized to one area, or dyspnea upon exertion. Complications of nephrotic syndrome include pulmonary edema, Cushing's syndrome, hypothyroidism, anemia, infections, and thrombosis. Glomerulonephritis may contribute to urinary tract infections. The patient is at risk for developing blood clots, so they may need prophylactic treatment with anticoagulants. This could include heparin, aspirin, or Lovenox. Other complications of glomerulonephritis include congestive heart failure and pulmonary edema. Both are directly related to fluid overload in the body. The patient may develop infections throughout the body. Another complication is hypertension, which is a high blood pressure, usually defined as greater than 140/90. Hypertension has many serious complications, including damage to the arteries, a stroke, aneurysm, heart attack, retinopathy, or even osteoporosis. Glomerulonephritis may develop after a patient has had bacterial endocarditis. Endocarditis is an infection of the endocardium of the heart. It lines the heart chambers and the heart valves. Endocarditis is a serious medical condition that can lead to death. If glomerulonephritis develops as a result of endocarditis, the patient will already be very sick. They will need aggressive medical treatment. You may see test questions about bacterial endocarditis prevention. This includes taking antibiotics before dental or medical procedures and having good oral care. Treatment of glomerulonephritis includes a variety of medicines. Since the patient may have hypertension, you may see test questions regarding blood pressure medications. Angiotensin-converting enzyme inhibitors, or ACE inhibitors, work by blocking the conversion of angiotensin 1 to angiotensin 2. This results in vasodilation and a reduced blood pressure. Angioedema and cough are adverse effects that are frequently seen on test. Some examples of ACE inhibitors are lisinopril, captopril, and benazepril. Another blood pressure medication is angiotensin receptor blockers, or ARBs. Common test questions about ARBs, including avoiding salt substitutes and potassium due to the risk of hyperkalemia. ARBs can cause the body to retain potassium. Do not take with NSAIDs. Examples of ARBs include losartan, valsartan, and prosartan. Another medication commonly prescribed for glomerulonephritis is corticosteroids. They reduce inflammation by suppressing the immune system. They have many serious side effects, including edema, Cushing's disease, osteoporosis, increased risk of infection, and weight gain. Due to the serious side effects, corticosteroids are not normally taken for extended periods of time. Patient education includes instructing the patient to not stop taking abruptly. They need to be tapered down. Loop diuretics may be used to reduce edema and swelling throughout the body. They work by decreasing the kidney's ability to absorb sodium, primarily in the loop of Henle. Remember, loop of Henle, loop diuretics. More sodium will be excreted in the urine. Remember, water follows salt. Loop diuretic side effects mainly have to do with electrolyte imbalances. The patient may have hyponatremia, hypokalemia, hypomagnesium, hyperuricemia. Gout, hypotension, and dizziness are also side effects. Furosemide is the most common loop diuretic seen on test. Antibiotics may be needed to treat infections such as streptococcus or strep throat. If the patient has hyperkalemia, they may need insulin to decrease potassium levels. Insulin causes potassium to go back into the cells from the bloodstream. Glucose is normally given with the insulin to prevent the patient from becoming hypoglycemic. Plasmapheresis is a procedure in which the plasma is removed from the blood. Plasma contains antibodies that may be contributing to the body's inflammation response. Plasmapheresis differs from dialysis. While they both filter fluid, dialysis filters metabolic waste and removes fluid. Dialysis may also be needed if the kidneys are impaired. Diet changes may also be recommended. The patient may need to restrict fluids so that they do not become fluid overloaded. Sodium, phosphorus, and potassium-rich foods may also need to be restricted. The patient may be asked to avoid processed foods, limit red meat intake, and fatty foods. Examples of foods to avoid include potatoes, tomatoes, oranges, and bananas. On to nursing considerations. As a nurse, you will need to know about dialysis. It can be either hemodialysis or peritoneal dialysis. Hemodialysis is a procedure in which the blood is cleaned to remove waste and water. In order to do this, the patient needs special vascular access. This could be an external shunt, arteriovenous fistula, or a graft. Peritoneal dialysis is a procedure that filters waste and water from the body. It uses the peritoneal membrane with a dialysate solution. Instead of vascular access, the patient will need peritoneal access. The solution is instilled into the abdomen and left for several hours. It is not as efficient as hemodialysis, but it can be done at home. Some things to remember with peritoneal dialysis include elevating the head of the bed to reduce pressure on the diaphragm, monitor for peritonitis, atelectasis, hypokalemia, pneumonia, or shock. There is so much more for dialysis that I'm not going to cover in this episode, but keep an eye out for an episode solely about it. Other nursing considerations include monitoring the patient's fluid intake and output. They may need to be weighed daily or before and after dialysis. Make sure to instruct the patient to weigh themselves at the same time every day and to wear similar clothing. Fluid retention is a common side effect. Monitor for edema, JVD. Also take the heart. You may hear extra heart sounds, S3 and S4. Also take the lungs. Crackles indicate fluid. Monitor for hypertension and tachycardia. The patient may need to be placed on telemetry while in the hospital. Telemetry monitors the heart rhythms. Electrolyte imbalances such as hyperkalemia can lead to dysrhythmias. The patient may be very tired, so be aware that small tasks can wear them out. To conserve energy, the patient may need small frequent meals, help with ADLs, or activity restrictions. We've already reviewed a bunch of patient education, so I'm just going to touch on a few things. Diet education is very important, and you frequently see test questions about meal plans. Remember to limit proteins such as egg, cheese, and red meats. Sodium, phosphorus, and potassium-rich foods should be limited. This includes leafy greens, avocados, potatoes, milk, bananas, and apricots. If the kidneys are impaired, the patient is at a high risk of becoming fluid overloaded, so they may need to restrict fluids. Educate your patient on monitoring their fluid intake and output. Low urine output is less than 30 milliliters per hour. You may also need to instruct them on monitoring urine appearance. Red indicates blood in the urine, and frothy or foamy urine indicates protein. Smoking cessation is always important. Inform your patient to stay active, but not to overdo it. Remember that strep throat is a risk factor for developing glomerulonephritis. If you have a patient with strep throat, inform them of the signs and symptoms of glomerulonephritis and when to seek medical treatment. Thank you for listening to this episode of Nursing Survival. Find me at nursingsurvival.com for more study guides. I have fill-in-the-blank guides and even coloring pages. You can find me on Twitter, Facebook, or Instagram. I'd love to hear from you. Please send me any topics you'd like to hear. Thank you.